Blood pressure balance is one of the most important determinants and guarantees of our health. Therefore, keeping our blood pressure values within normal limits is the most important condition for a healthy life and good aging. As is known, we have two separate blood pressure figures. These are systolic blood pressure and diastolic blood pressure. In fact, the rise of both, and staying high for a long time, is a very important threat to our cardiovascular health. But still, we always have the same question in mind. So, which blood pressure rise is more important than the other? Many physicians have thought for years that high diastolic blood pressure is more important. To date, many health authorities have assumed that increases in systolic blood pressure are more easily tolerated by the body. That is, the theory that consistently high diastolic blood pressure is more likely to cause vascular and organ damage was accepted by many physicians. But this approach has changed considerably in recent years. It is now accepted in the scientific world that high systolic blood pressure is at least as important as high diastolic blood pressure. In other words, it is an accepted fact that there is no serious difference between the two blood pressures in terms of damage to tissues and organs. In fact, it is accepted that systolic blood pressure may be a more important risk factor at the age of 50 and beyond. Remember, regardless of your age, your systolic blood pressure should not be greater than 13, and your diastolic blood pressure should not be greater than 9. The ideal number is always below 12 for systolic blood pressure, and below 8 for diastolic blood pressure. Let's make another small reminder. Diastolic blood pressure, lower than 9, and greater, systolic blood pressure, higher than 14, indicate the presence of a very common, high blood pressure problem, called isolated systolic hypertension,